Panic attacks and anxiety attacks are terms often used interchangeably, but they represent different manifestations of anxiety disorders. Panic attacks occur suddenly, with intense and overwhelming physical and psychological symptoms, including a racing heart, shortness of breath, and a terrifying sense of losing control. Anxiety attacks, on the other hand, though not officially recognized in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, are characterized by a less intense but more prolonged feeling of worry and fear that builds up in response to a stressor. Treatment for both conditions may include psychotherapy, medication, or a combination of lifestyle changes and relaxation techniques. Risk factors for experiencing such episodes can include genetic predisposition, major stress or life changes, and existing mental health conditions. Here are the detailed aspects of panic and anxiety attacks, providing a deeper insight into their distinctions and similarities. Affected systems: autonomic nervous system hyperactivation versus persistent irritation. When distinguishing between a panic attack and an anxiety attack, the manifestation of symptoms within the autonomic nervous system is key. Panic attacks are acute, intense episodes characterized by a sudden onset of fear or discomfort, where the autonomic nervous system becomes hyperactive. This hyperactivation results in physical symptoms: rapid heartbeat, perspiration, dizziness, and shortness of breath. By contrast, anxiety attacks often involve a more prolonged state of excessive worry, where the irritation of the nervous system is less about sudden hyperarousal and more about sustained heightened nervousness. Symptoms such as restlessness, muscle tension, and difficulty concentrating are common, reflecting a persistent irritation rather than abrupt hyperactivation. Understanding the nuances between these conditions is crucial for accurate diagnosis and effective treatment. Onset speed: sudden and acute versus gradual buildup. When distinguishing between panic attacks and anxiety attacks, onset speed plays a critical role. Panic attacks typically emerge abruptly, reaching peak intensity within minutes, creating an overwhelming wave of fear that can include heart palpitations, shortness of breath, and a sense of impending doom. They can strike unexpectedly without an obvious trigger. In contrast, anxiety attacks usually develop more gradually. The escalation of worry and tension builds over time, often in response to a stressor or anticipatory anxiety about a potential threat. The symptoms, although similar, such as worry, distress, and physical discomfort, intensify as the stressful situation approaches or persists. Understanding this temporal difference aids in accurate diagnosis and appropriate treatment strategies for both conditions. Symptom intensity: intense peak versus moderate but prolonged. A panic attack often manifests suddenly with intense peaks of overwhelming fear and discomfort, reaching its height within minutes. Symptoms can include palpitations, sweating, trembling, shortness of breath, and a fear of losing control or impending doom, mimicking life-threatening conditions like heart attacks. Contrarily, an anxiety attack, although not formally recognized in diagnostic manuals, is typically used to describe prolonged episodes of anxiety with more moderate symptoms that build gradually. It can stem from specific stressors or chronic stress marked by worry, restlessness, and muscle tension, lasting for days or even longer, impacting an individual's ability to function in daily life. Distinguishing between the two can inform appropriate interventions, be it immediate or long-term management strategies. Trigger clarity: specific trigger versus diffuse or accumulated stressors. When discerning between a panic attack and an anxiety attack, the trigger's specificity is a key differentiator. Panic attacks often arise abruptly and without an identifiable cause, wreaking havoc with intense physical symptoms like heart palpitations, shortness of breath, and an overwhelming sense of dread. Conversely, anxiety attacks are usually the culmination of prolonged stress or worry, manifesting in a more prolonged state of distress. Unlike the unpredictability associated with panic attacks, anxiety attacks typically have identifiable triggers linked to stressors or fears, providing some foresight and potentially allowing for early intervention strategies. Recognizing the nature of the trigger can facilitate targeted treatment approaches, such as cognitive behavioral therapy, for anxiety or panic disorder-specific medications. Duration and resolution, short-lived with rapid decline versus extended with slow resolution. Panic attacks typically strike out of the blue, presenting an intense and overwhelming rush of fear or discomfort that often peaks within minutes. The experience is acute, with heart palpitations, shortness of breath, and dizziness emerging swiftly, plunging the individual into a state of high alert. Conversely, anxiety attacks are not officially recognized in the DSM 5, but are often used to describe a prolonged feeling of distress. These episodes are generally less intense than panic attacks, but last longer and resolve gradually. While panic attacks subside relatively quickly, anxiety provokes a simmering worry that dissipates slowly, potentially persisting for hours or days, reflecting a chronic backdrop of apprehension and unease.